In this video, I'm going to discuss the subtle differences between aesthetic beautification and rejuvenation with the use of cosmetic injectables and the gulf that exists between different aesthetic practitioners and their capabilities in achieving beautiful and natural-looking results. Hi, this is Anna, and I'm a clinical director and founder of Anna Medical Aesthetics. This difference stems from the fact that a lot has changed in terms of our understanding of how to use cosmetic injectables since the UK launched the first filler in 1988 and Botox in 1994. The first injectable filler was used for lip enhancement, and Botox was initially used for frown lines between eyes. However, aesthetic professionals today will often combine Botox and fillers and use them in multiple areas of the face and neck to enhance someone's facial features, alongside reducing the appearance of some of the classical signs of aging. At medical conferences and in some of the training courses that I run for the colleagues, we often talk about the use of cosmetic injectables for beautification or rejuvenation. Typically, beautification might be sought by a younger person who wants to enhance the way they look to become a bit more attractive. Commonly, this will involve using filler in the lips, nose or cheekbones or jawline to enhance facial symmetry, or the Botox for forehead to reduce the potential negative effect of frowning, so they have more open and inviting expression. Cosmetic injectables for rejuvenation are mostly used in the more mature people, where signs of aging can be softened to restore a more youthful appearance. In practice, this might include reducing the appearance of age-related volume loss across the face, especially around the temples, under eye areas or cheek using dermal fillers, or using anti-wrinkle injections such as Botox to improve crow's feet or forehead lines. In addition, there are now a range of Botox toxins to choose from and several hundred dermal fillers available around the world. As you can imagine, there is a difference in terms of cost, performance, safety between the premium and the cheapest brands of injectable treatments that professional aesthetic practitioners take into account when choosing what and where to specifically use it in their patients. In practice, the boundaries between beautification and rejuvenation are often blurred, and the main aim of expert practitioners is to choose the right injectable product and specific injection technique to achieve a result that is balanced, natural, and harmonious rather than making you look odd or unnatural. However, because of the lack of effective regulation that has been a feature of the UK aesthetic market since cosmetic injectables were first launched, there is a vast difference in capabilities between different practitioners advertising their treatments. Unfortunately, at one end of the spectrum, someone can go on a one-day course and offer injectable treatments part-time along their daily job. However, it's only the best full-time professional aesthetic practitioners that have the right advanced training, technical abilities, and experience of treating hundreds of different faces that can offer the safe treatment experience. In addition, these are often the people that also possess the talent and the artistry to know how to get the most natural and harmonious aesthetic results that will last for longest period of time. If you want to reduce the likelihood of being disappointed with how you look after treatment, or having a potentially serious permanent or disfiguring side effects associated with the poorly delivered cosmetic injectables, I recommend that you seek someone who is medically qualified and who has undergone an appropriate level of training, ideally a master level qualification. Of course, you'll often pay more for a specialist qualified practitioner, but choosing an injector on the cheapest price alone can be a false economy. As a result, might not last as long. In the worst case scenario, you might have to pay for a specialist to correct poor work or side effects that are caused by a non-specialist practitioner. Hopefully, this brief video will have given you a better idea about the level of training and artistry required by a professional aesthetic practitioner to achieve a subtle, natural, and beautiful results with the dermal fillers and Botox. If you're interested in having cosmetic injectable treatments and would like a more comprehensive guide to choosing the right practitioner for you, please just click at the link at the end of this video. The guide is free and no email or phone number is required, as it's been written to help you to avoid some of the common mistakes that people make when putting their trust in a provider of Botox and filler treatments.